I'll give the call to the member for Chifley.
The electorate I represent, Madam Deputy Speaker, is proud to boast the highest urban population of Aboriginal Australians in the country. People from various lands have made their home in the land of the Darug people, and like all communities, accessible, quality health care is a priority for many. For the last 28 years, residents have benefited from the services of the Mount Druitt-based Aboriginal Medical Service of Western Sydney. And I've previously spoken within Parliament about the important need for AMS to continue to provide culturally appropriate primary health care and coordinated allied health care. But for some time there have been concerns about the threat posed to AMS by a combination of financial, taxation and administrative challenges, and the interaction of these challenges led to two events. First, that the federal government announced in, it would have been in late June, that it wouldn't provide continued funding to the AMS beyond a 3-month advised period, which then triggered the second event, a decision by the AMS board to place themselves into voluntary administration. Both the Howard and Rudd governments had previously intervened to extend financial assistance to the service. In light of the current financial circumstances in which AMS finds itself, the question was asked, would a third wave of assistance provide a sustainable solution to the organisation's situation? And the Abbott government decided not to proceed down that path. The easiest thing for me as an opposition representative is to criticise and campaign against the decision. But I'm not interested in politicking. I want a service to remain in our area for our Aboriginal community, and I want solutions. I'm taking this opportunity to report to the Parliament and my community about the steps I've taken to achieve this. I've represented the concerns of our community directly with the Health Minister, and having spoken with her and advisors to both her office and the Office of the Assistant Health Minister and the Minister for Indigenous Affairs. In July, the member for Lindsay and I, who share a conviction about maintaining the service in this area, met in my office in Mount Druitt with representatives of the Assistant Health Minister and the Federal Health Department about what can be done to maintain the service in our area. At all times, I've strongly urged the federal government to acknowledge 3 critical priorities relating to the service, priorities reflecting the concerns of senior members of our local Aboriginal community. The 3 priorities are: 1, that there is a continuity of service, as much as possible, minimum disruption, and that our local community continue to access health care while a longer-term service is being provided. It's been estimated there are about 11,000 people who have or are using the service, and they need to be able to continually access that type of assistance. 2, I've said that the frontline people employed by the AMS be maintained in their positions, or that the same number of people continue to provide service to our local community. And 3, that in the interim and into the long term, that the voices of the local community be represented in an advisory committee, and that there is local control and maintenance of that control by the Aboriginal community in relation to healthcare services. I have to say that at all times the government has indicated their willingness to observe those 3 priorities. They have worked to their credit within the federal and in the state jurisdiction to see what can be done. I'm particularly grateful for the involvement of a Medicare local, now renamed, but went west through the leadership of Walter Komet. He's providing a degree of assistance in the transition period, and I want to thank them. And I understand the member for Lindsay has coordinated within her area for a equal service to also provide some assistance in the short term. The only criticism I would have is that I've asked a number of times that the local community be provided, that all the patients of the service be either emailed or written to, and that they be advised about what's happening with the service and the fact that the service would be maintained. I do not believe an adequate communication strategy has been employed, and I do remain hopeful that there will be appropriate actions taken in this regard. Again, I come back to the point. If this looks like it will be a maintenance of service, if the Abbott government is maintaining service within the existing funding envelope, then that is good and that is proper, and I will support it. If this is a mechanism to shut down the service, I will be one of the most vocal opponents of what's being done, but I see very little evidence at this point that this is what's happening. it is clear that both sides of politics are working together very actively to ensure that our local community maintains a health service in an appropriate and quality way.
I thank the member for